Good morning, everybody. It's truly a pleasure to be here. I'm kind of excited about talking about this topic, and I'm also a little humbled and flattered at the same time. It's kind of flattering to be here to talk about this in a really exciting topic, but at the same time kind of humbled that anybody wants to listen to it and also be on the panel with these amazing people. So just, I've been asked to talk a little bit about Purdue and our journey, a little bit about our sales force and where we're heading, and this is specific to our sales force and our evolution. And I want to start by saying nothing's broken. We're doing well. We're doing very well in the context of our business today. But our business is changing and it's morphing over time. So let me just take 30 seconds to give you a little bit of context. I'm sure there are people in this room that know Purdue Pharma, Canada, but there's also probably a lot of people in this room that do not know who we are. So Purdue's a medium-sized pharmaceutical company. We've been in Canada for over 60 years. We're independently owned and operated. We do our own decision-making in Canada. We're not part of a global entity in that regard. We've been in the pain space for over 30 years, and we're the leader in that space. And for the last decade, we've actually carved out a niche in ADHD, where we're now seen as one of the leaders in ADHD. When I think about where we have to go, we sat down with the new leadership team about 4 years ago, and we looked at our business and we said, where are we going? What's our 5-year, 10-year vision? And we realized that our business needs to change. We invested heavily into BD and R&D. And those people have been working very, very hard for the last 3 or 4 years. And now I'm faced with, we have a ton of things in our pipeline coming to fruition. And this is going to change what we're doing. It's going to change how we operate and what we're selling. We're going from a company that has not launched products since 2010, 2011, and those products were actually launched in the spaces where we've been, to launching multiple products over the next few years in many different GP spaces. We have to change how we do things. So we went back the last 2 years, and we kind of looked at what we have to do. And so I've looked and said, over the last year, in my new role, what do I have to do, what does our team have to do to prepare for this new future? And really, it's looking and saying, to be successful, do we have the right tools in place? Do we have the right footprint? Do we have the right infrastructure? Do we have the right CRM? Do we have the right reporting structures? Do we have the right dashboards? Do we understand the competencies and the skill sets of the individuals? Will we have the right training people involved? Do we know that? We've done our gap analysis and we figured that out and we've started putting those things in place. What I think is really cool though, and one of the biggest and also most daunting things, is how do we create that culture that will take us to make sure that when we launch these products, we do it well. What will give us that competitive edge? And I think the competitive edge, as we've seen from Dr. Jameson and from John earlier, is not reps just doing their job and hoping to keep their job, but people that are actually inspired and want to do the most and make that difference in a doctor's office, understand the passion that comes from talking about the disease state, and just feeling like they own that business and want to do the most that they can. So one of the things that we have to do is I look forward and I go, what is the ideal operating state? The ideal operating state is really that sales rep, that sales, I'm going to quote the term, sales CEO, the person in the front line that will own this. Instead of being that top-down approach of here's who you call on, here's your key messages, we really want to turn that around and actually empower the representative to think about their business. Have multiple products in their bag and go, what makes the most sense to talk to this physician about today? We have to trust those individuals to make that decision. And I think doing that, talking about accountability, giving the rep that accountability to do that will empower them and make them even better and stronger, and it will give us that competitive advantage. One level up, probably the most important role in the organization, is that frontline manager, that people leader. We took time and kind of went, what is the most important thing that these people do? They've been spending, if I look back at the last couple of years, they've been managing all these processes, they've been managing people, they've been working with people, they've been flying in doing coaches, they've been coming out, they've been doing teleconferences for head office. We sat down with them and said, what is the most important thing that you should be doing? And it's coaching. It's coaching is what they should be doing. So we actually aligned them and said, this is the most important thing. How do we do this? I want you guys in the field coaching your people 60, 70% of your time. And we have to change the model at which we're doing that. You have to develop and empower your people to make a difference. One level above that is a new role that we created, which is the regional managers. And we have the ability to give them the opportunity to be leaders, align with the vision, but also to be flexible in understanding their business needs in the different regions of the country so that they can be adaptable and figure out what works best for their region. Again, giving accountability at all three levels. I'm going to take a step back. This started about 2 years ago. We had Dr. Jameson come in, and it started with our commercial operation team. So all the directors, marketing, sales, operations, et cetera, getting in a room and going, where are we? What is our culture? Where do we stand today? And we did the entropy. And I'm pretty sure it's myself that brought the entropy score down, without having enough self-actualization. But we actually came out of this with, here are the things, the 10 things that we believe are the most important drivers. Kind of the mandate, our call to action to say, these are the things that are important to us. And so, yes, you're a leader, customer focused, team, have fun, you can read the list, but it helps center us as to where we should go. So we did that 2 years ago, and I reflected, what should I be doing with my team? And that's where we sat down and kind of went, I want to do something similar. And so we've aligned the regional managers. We started with them. What's your job? What's the important things that you should be doing? What's our vision? Who are we? What do we want to accomplish? We figured that part out. We took it one step further. We went and did an entire day with the provincial managers, as I talked about. And we worked with them to figure out what it is their job is and how are they going to be happy, what's going to make them impressed and move things down from a culture point of view. Currently, we just pulled in some of our top reps and said, what environment would make you guys, what makes you the best today? How can you learn from each other? And how can we raise our game to the next level? As our business is shifting, I need you to think differently. I need to empower you. What are the quick wins? What is the environment that you need that we can do to help create this that will make you more successful? And how will we use you guys, quite openly, as change agents to empower everybody else and to use you guys as the role model for the future? Just to give an example of a day with our provincial managers. And I think any sales manager, anybody who's worked with sales understands the role of the manager going out, typically riding along with a representative. I'm just going to give you, this is some of the feedback from our team as to what it is today, or has been. And it's really a little bit of pre-call, little planning. It's a little bit of a shotgun approach. We're focusing on evaluation versus building people up. Selling on their behalf. Sometimes, managers will get in and actually do the sales call versus actually watching and helping the rep develop. And what we really want to go is actively planning, focus on that coaching, observe and provide feedback. What are the 1 or 2 areas that we can improve upon? And instead of doing this, as we call it, the peanut butter spread of coaching with everybody, asking representatives, who wants to work with me today? How many times do you want to work with me today? How do you want to get better? How can I actually bring value to you as a representative? And it's that just cultural mind shift that we're trying to do and instill at this point. So where are we now? Well, we started on this path. And like I say, I don't want to break anything, but at the same time, we have to change the way we're going. We've involved our manager group. We've started to involve our reps at the top level. We want to use them as change agents moving forward. And really, we're on this journey that we'll see, hopefully, as we start launching these products over the next 2 to 3 years, actually starting in January, very positive results. So, key takeaways. If you want to be excellent, make sure you have the tools and the infrastructure, but most importantly, think about the culture. Think about where you want to go and how do you want to empower your people to be successful. Idealize and improve, basically define what the ideal future state is and work towards that end. And culture must change with visible leadership, and it starts at the top. So that's my 10 minutes. I can't believe I did that in 10 minutes.